I think we are on the same page with me.
So
I think we don't tell names, but 2-3 people were concerned that the other person is negative. Well, we're gonna do it, but whatever you do, you have to protect the person who trusted you. Like that's the you convince them by telling them that I'm not gonna mention your name. So there's no way that you're gonna turn around and say, okay, is your husband or is your whatever. You know, deep inside, maybe you feel like you wanna do it, but even if this person trusted you and you know their status and they are trying to see your sister, like you have an affair with your sister, all you have to do is to tell your sister to watch out for HIV. Still, it's going to be a breach of contract if you tell the person, you maybe your neighbor or your friend or whatever. It's the same way. You can't tell them. So basically, everybody has to protect themselves, because if you don't, nobody's gonna. And again, you have to tell that person that, you know what, whenever you have an affair, make sure that person is tested or use your condoms all the time. That's all we can do. But sometimes the inner spirit comes in and you feel like you're going to save the world, but you can't, because still, even if you save them from Edward, somebody else is going to come. All we have to do is harm reduction and do our best. Again, there's no sharing of the patient's information with the partners, and you try to notify within 24 to 48 hours, especially if it's providers and they've given you all the information. Don't sit on that information to look for an opportunity or whatever, 2 weeks or 4 weeks, because you never know, maybe they gave you somebody who they've just found as a lover, and maybe they are in that period that they can be saved.
This is a situation where some of the husbands feel they are very trustworthy, or they've never gone outside their marriage relationship. And if you come to the husband of that nature with the message that somebody don't you think that husband is going to chase you away?
Yes.
Says, me, I have your case, please keep away. Don't you think of a scenario of that nature?
Yes, I know. Yeah, I do understand where you're coming from. I know a couple, actually, they came here. The lady is a friend of mine, was pregnant and was diagnosed with HIV. She knows and she swears to God she has never gone anywhere. But the funny thing, the husband was negative. She was able to tell him the husband was negative, the baby was negative, the husband refused to use condoms. He said, I know my wife has never, we tested before marriage. There are some situations, but again, HIV, before we knew, especially here, it can be spread through other means, not necessarily. That's why healthcare providers must be knowledgeable, because you never know. Even before, people used to get it from hospitals. I don't want to say that, but it has happened. There's a good friend of mine, a doctor I used to work with, and I know everybody who knew him, they knew that this gentleman didn't do anything outside. He was a very strong Christian. They tested before marriage. Don't say, doctor. Even people who were not really Christians, they stood for this man. But I had worked with him when HIV had just started. Most of the doctors would dodge procedures like, all those institutions, they would be, if they knew the diagnosis. But this gentleman would be the one doing all these sutures and all that. So, and then, before he knew it, the wife had HIV when she went to play. And the wife, when they got married, because they were strong Christians, she was even a virgin and they attested to it. So, the poor girl, actually, the family members, when they were burying her, wanted to kill this gentleman. Because they said, we knew she didn't do anything, you were the one who killed her. So it was like a tug of war. All I'm saying, you can still get it, not sexually. But I have a feeling that maybe something punctured him, because he was really the one helping these people when most doctors were really scared. So, but he's still living with the treatment and all that, but the wife passed away. So all we have to do is to educate them that there are other means of getting it, especially before you knew. There's a person who told me, you know how you lose relatives here in Uganda, they used to shave off all the hair. They were using only one razor blade from you know, for the whole, almost the whole clan. And the people got infected and through those cuts and whatever. So it can still happen. All you have to do is just tell them that this is the situation, and it can still happen, especially where there are some other means. Yeah. So do what we said is the doctor and or the counselor with the person who is already positive, they bring the partner to you. So here you have to tell them that there's no confidentiality because it's not going to be anonymous because you are the one bringing them. So basically, they know you are already positive, but it's not bad. It's because whatever questions arise, the medical personnel is there to answer.
So who breaks the news at that time?
This is the discussion that you have with the client. If they feel like they can do it, they go ahead. If not, they give you, so you work together. So you discuss before they bring the patient that you think you can begin them that, you know what, I came here for treatment, they tested me and they found out that I'm HIV positive, but in case of any other patients, yeah, ask them. But I feel like you should be tested so that we can get medication and get treatment and whatever. So there's a discussion, like I said, prior to the meeting with the partner. It's not easy. It will never be easy because the stigma, the fact that there's no cure, so it's a complicated situation. But at the same time, you have to do it. We have to help these people who don't know that they are positive or whatever. It's gonna say yes if you don't. That the client may not have to reveal their names. They just want to help the other person to get treatment. It may not. It may be safer for them. The person will not know. And again, partners are informed of real risks, and at least they know that you know what, they can also get, they can be HIV positive. So yeah, it interferes with the spread to other partners or unborn children. Because if somebody knows and was planning to have babies, they may think twice, they may get tested, and if they find that they are positive, at least they will join prevention and save the baby. So benefits to the clinician, because you want to get this off, you know, it's really hurts when you see somebody is positive and they are married and they are seeing 2-3 women. It's like, you know, what can I do? So this is something that can help you. At least you know that you did your job. At least you try to save somebody. And it's also good with case finding, because the cases are out there and you don't know. They don't know. They're just walking and say high percentage, maybe like 50% of people who are HIV positive, they don't know that they're HIV positive. So it's our job to really try to get them into care before they even hit AIDS stage. Because people now live with 30 years on medication. I've seen people who have been in treatment forever, 20 years, and they look better than I look. Challenges, and that's what we've been talking about. There are so many challenges of partner services. Number one, you may try to convince people and they are not interested at all. They said no, there's nothing we can do, we can't force them. And especially if you know that they are living reckless lives, they don't care, they have 2 wives and whatever, they are dating young kids, they are dating. It's painful deep inside if they don't accept partner services. And again, potential for negative effects. We know that although you tell them, they may be abandoned, they may be abused, they may be extreme cases of murder, whatever, anything can happen, you know. So those are the stress of the relationship, because most of them, especially here, you know, we as Africans, it's very, very hard to stay with the person when you know they are positive. But there, I'm telling you, people can say, oh, okay, I'm still there, I'm still in, and I'm still, you give us whatever. So there we have a lot of stuff that is given, like dental dam when they are kissing. They know that the other one is positive. It's like a rubber, smooth rubber, just like a condom, but they're putting dams. They have like finger-like condoms, like whatever you are doing with your finger, you can still go ahead when you know the other partner. So they always try to stick together. whether positive or negative. So we just give them all these necessities. Look at the doctors. Yes, it happens. But here most people take off and they don't want to be part of it. And if you allow them, they will say, okay, I'll take care of you. But there are so many things go ahead. Yeah, emotional physical may result from pattern medication. I didn't know you didn't have them. I would have carried some to show you. No, because I thought most hospitals now are also advanced. They have stuff. Yes, yeah, we have them that you give them and they live happily forever. And the other persons, I don't know. They are common concerns. There's threats to confidentiality, of course, because you tell one person and they tell, yeah, you can tell your husband and then it's going to tell like whatever I said, the mother and village is all going to know. So that's a threat, especially if you don't do provider. And again, we are talking about violence, especially against women. And I know they started this program somewhere in Zimbabwe. I remember reading it, and they used to call it the divorce program. Because women were, especially because most African countries, they test women first when they're pregnant, and then they go to tell their husbands, and the husbands take off. So they used to call it the divorce program. But I think things are getting better now. And again, the stigma-related discrimination, and for the providers, increased workload, because if you are going to spend like 2 minutes with a client, now because you want to convince them and you extend the period. So increased workload for providers, especially if you have limited time, but you need to talk to them and listen to their stories and take it from there. And again, the unclear legal expectations, because this one varies from country to country, from state to state. Yeah, because if you know that if somebody is positive, and maybe the bill has already passed that if they are positive they cannot, so it's going to be different. I don't know how it's going to turn, because I think they will be required to notify their partners when the bill finally is in place. We have challenging cooperation. I remember when I was talking to this gentleman in the beginning, when I first met with him, he was telling me about, children and all that. Yeah, children is among the challenging cooperation, because when you tell them, maybe they got it from their parents, you don't want to, it's really a sad situation. And also there are people with development challenges. How are you going to tell them they are positive and maybe they are psychotic, You can be working with a client who has a mental diagnosis. You don't know how to handle the situation, and people who can't hear well, and it's a private conversation, and you need an interpreter, so it takes steps. Maybe a family member is the one who understands them, and it's going to do the sign language. So it's a challenge to the providers on how we're going to do them, and people who abuse alcohol and all that, they're going to get drunk, and it's hard to convince these people. But again, we still have to do our best, and sometimes we need other services of